a patient says to me, I'm having pain in my hip, my first question is always, show me the pain. Hi, I'm physical therapist Katie Wolfley, and today we're talking about hip pain. So when we think about the hip and hip pain, it's important for us to consider where that pain is in order for us to determine the source or the cause. The hip itself can be broken down into different areas. Hip joint itself is a ball and socket joint, so we have a flat surface and a round surface coming in contact that meet right at our front pocket. When we think about the front of our hip, we could have pain that's going into the groin, it can be coming into the front of the thigh, and these areas can tell us of different sources. Some of those include the labrum, which is a cartilage piece that covers that flat surface of the socket that the ball meets. It's intended to protect the surfaces from friction. But with wear and tear, that can get pinched, it can get torn, and that can cause pain through that front space. We also can consider arthritis. Hip arthritis, when it's really severe, can tend to cause pain shooting through the groin, and that's breakdown of those surfaces over time, having those bony contact points and creating pain. We can also consider that a low back pain. If the line of pain comes around the front and into that front space, that can be a source of pain as well, meaning that we need to check out the low back to make sure that that is not the source as opposed to the hip itself. When we think about the side of the hip, there's so many structures over here. We need to consider that we have bursa sacs. They are meant to protect the tendons as they come to contact and meet at the bony edge of the hip. And when there's too much friction with those tendons, or if they're too tight, that can fill up with fluid and that can cause pain. We also have just those attachments of the tendons, and the tendons themselves can be having issues and pain from overuse. We also need to consider that our IT band, the tendon that runs along the side of the leg, comes up and meets a muscle up here at the side of the hip. That can be a source of pain, especially for patients or people who like to run, do repetitive workouts with jumping and impact loading. That can be a source. And then we even need to consider the back side of the hip. In the back side of the hip, we do still have all those muscles, large muscle groups. They attach around there. There's specifically the piriformis, which runs over top of our sciatic nerve, and if that muscle is too tight, it can cause pain that even might radiate down the leg or through that back space. And just because of their location and being so close together, of course, the low back can cause pain right in this area or pain shooting down the leg. So again, we need to consider that the low back might be a source of this, and we should probably check out to see who's really bothering you. So, hip pain, not really an easy question to answer, and it's not a one-size-fits-all. So if you're someone who struggles with hip pain in any of these areas, perhaps consider changing the impact loading that you're doing on a regular basis. So if you're a runner or you partake in any exercises that do a lot of jumping, hopping, try to reduce that intensity and see if that takes down any of the pain inflammation. If you're somebody who tends not to move or not to partake in a lot of activity, try to get moving, even if it's little things like just trying to be walking and moving a little bit more, as that arthritis or issues of lack of movement can cause pain in the hip as well. If any of these strategies don't work for you, maybe it's time to get seen. Contact us and get in touch with one of our physical therapists for a personal assessment so that we can create a personalized guide for you to get you back to what you want to do.